Imagine that this is Matthew, a 20-year-old information technology student in a state university. Matthew was diagnosed of having Hodgkin's disease and undergo chemotherapy. He has been hospitalized 3 times for chemotherapy and for adverse effects of chemotherapy. Matthew is experiencing gross bleeding when he urinates. Dr. Paris admit Matthews in the pediatric oncology unit. So Matthew and his parents arrive in the medical unit. Make sure to wear your PPE, like your gloves, face mask, and your hairnet. So Matthew complains of weakness, dizziness, shortness of breath, and anxiety. His skin is cool and clammy. Now, we're going to perform a placement of three-way catheter with a continuous bladder irrigation with a sterile manual saline. Imagine that this is a three-way catheter. We're going to insert this one. The back. And we will inject. And with a continuous monitoring of oxygen saturation with your pulse oximeter. Imagine that this is a pulse oximeter. Administering of intravenous fluid of lactated ginger solution to infuse at 200 ml per hour. His temperature is 38 Celsius or 100.4 Fahrenheit. Pulse rate with 110 beats per minute and a respiratory rate of 33 breaths per minute. And blood pressure of 90/60 mm per mercury. The oncologist prescribed cyclophosphamide, prednisone, vincristine, and etoposide medication for Matthew. For the continuous nurse intervention, monitor respiratory status. If lymph nodes are met, chances involved the patients may experience shortness of breath, dyspnea, or words of obstruction. Note for the changes to skin color. Note for the pallor or the cyanosis, the white blood cells or multiple rapidly can reduce carrying capacity of red blood cells, resulting to hypoxemia. Assist and manage the pain. Patient may experience pain from radiation and chemo. Pain management reductions of stress, promotes healing, or conserves energy. Have a nutrition education. Increased calorie intake promotes healing, providing energy, prevents gastric distension, and monitor daily the weight calorie intake. Assist with the positioning and monitor skin breakdown. The fatigue and the impairment Impaired nutrition can cause muscle weakness, assist the position of comfort, optimal exchange to monitor for skin breakdown, provide emotional support to the patient and to the family. Extensive tests must be explained to the patient because there is a tendency towards anxiety and ineffective coping. Teach the patient about the risk of infections, advise the patient to monitor temperatures and report any fever or other symptoms promptly. Explain to the patient the gradations and therapy that may cause sterility. After the nursing intervention, make sure that the goal is met as evidenced by the patient is now out of the risk of infection and already have the adequate ventilations and reduce of the pain and can now verbalize the feelings or his feelings regarding or in terms of his anxiety.